What does orthopedic mean? If we look at the components of the word, ortho means straight, upright, or correct. There are many words that reference this. For example, orthography. Graph refers to writing, therefore orthography refers to the correct way of writing based on its standard usage within a language. Odon refers to teeth, therefore an orthodontist is someone who straightens teeth. Static means to stand, therefore orthostatic hypotension refers to low blood pressure upon standing and being upright. And lastly, pedic refers to the rearing of children. So, the direct meaning would suggest that orthopedic refers to the correction or straightening of children? Well, yes, this is true because in the past, most orthopedic patients were young. Orthopedic surgeons often tend to the skeletal deformities in children. Nicolas André Dubois Regard was a French physician who first used the term orthopedics in the title of the book. The frontispiece was a crooked tree tied to a straight stake, and this is known as the André tree, and this is the symbol recognized as a symbol for orthopedic surgery. This is the anatomical position. This is the general reference position used in medicine. When referring to something as closer to the center, it is described as proximal, and away from the center as distal. When referring to angulation, we describe the position of the distal portion relative to the proximal portion. Bowed legs is referred to as genu varum, given that the distal portion from the knees moves towards the midline, and genu valgus refers to knock knees, where the distal portion moves away from the midline. When looking at the upper limb, dorsal refers to the posterior portion of the hand or limb, whilst the volar refers to the palmar side of the hand. Therefore, there is volar angulation of the following fracture, and in this example, there is dorsal angulation of the distal portion of the fracture. If we look at the knee, note that this is anterior and this is posterior. The following fracture is a distal femur fracture, and its angulation can be described as anterior tilt or apex posterior, whilst this is the opposite and is described as posterior tilt or apex anterior. Adult skeleton is composed of an axial and an appendicular skeleton. The axial skeleton is located along the long axis of the body, and its function is to support the posture, maintain stability, and to protect the vital organs. The bones are often fused, whilst the appendicular skeleton is located more distally and involves the girdles and limbs. It enables locomotion and digital manipulation of objects. Bones here are typically not fused. There are various types of bones, and these include long bones, such as the humerus, radius, ulna, femur, tibia, and fibula, short bones, which include the carpals, tarsals, patella, and sesamoid bones, flat bones such as the skull, scapula, sternum, and ribs, and irregular bones, which include the vertebrae, sacrum, coccyx, and hyoid bone. Long bones are composed of a hollow shaft, or a diaphysis, a metaphysis, which is below the growth plate, and an epiphysis, above the growth plate. The diaphysis is composed of a dense cortical bone, which surrounds the marrow, whilst the metaphysis and epiphysis are largely composed of trabecular bone, which is the honeycomb network of bone surrounded by a thin layer of cortical bone. Overall, the skeleton is composed of 80% cortical bone and 20% trabecular bone, but different bones around the body have different cortical to trabecular bone ratios. Regardless, bones whether cortical or trabecular are composed of osteons, which are the structural unit of bone. An osteon is composed of concentric layers of bone known as lamellae. Cortical bone is solid and has an outer periosteal surface and an inner endosteal surface. Bone formation exceeds bone resorption of the periosteal surface, therefore bone increases in diameter with age, whereas with the endosteal surface, bone resorption exceeds formation. Therefore, bone marrow space increases with age. The outer surface of bone is covered by connective tissue known as periosteum, except at the articular or joint surface, which is covered by articular cartilage.